Welcome. Welcome to rpay.org, which stands for Reimbursement Premium Adjusted Yields, which is nothing than account-based healthcare through health savings account for you all Americans. Thank you for joining us. And here I am trying to talk about how to develop a consensus, a national consensus on healthcare, which basically um, you have to create an interest, and you have to create attention and action in the public. Let's look into how to develop a national consensus on healthcare. We'll go into the detail. Real change requires real change, yes. Out of all the stakeholders, the consumers must be front and center. Remember, for most part, the access to affordable health insurance or even a health care starts with affordable health insurance. Advocating consumer-driven, personalized health insurance will require consumers change from passive interest to demanding action. Get politically active and personally aware of your ability to make a difference. Yes, ability to make a difference. Here are some of the ideas, folks. I'll give you one by one. I'll give you some ideas how to gain attention. Number one, write to your congressmen, senators, and other elected officials and ask an elected official to form and participate in health insurance reform task force. They need to appoint a health insurance reform task force. Number two, write op-eds to your local and national papers regarding consumers controlling the healthcare. And number three, be a guest or a caller on a local, regional, or national health radio talk show. You could do that. Any one of you can do that. You can be a national spokesman. And number four, respond to articles and posts on the social media. That's another way to interact on the social media regarding consumer-driven healthcare. What are the benefits? And number five, contact human resource department where you're working and request more consumer-driven and patient-centric options. All of you can do that, folks. All of you can do that. And number six, make additions to health savings accounts, which is a task. I want all of you to contribute into the health savings accounts, each one of you individually and a family. In my previous segments, I talked about how much. It is not really much if you really look at $10 a day for individual, $20 a family. $20 a family, folks, for your future healthcare needs. That's not much, but it gives you a total empowerment down the line for 5-10 years from now. And number 7, understand and meet the standards of your company's rewards and incentives. You need to, wherever you're working, you need to look at companies' rewards and incentives. And number 8, lower unnecessary utilization of medical services. Ultimately, you as a consumer can lower the utilization and lower the cost of the healthcare. And number 9, know and control your biometrics like your blood pressure, your cholesterol, your body mass index, waist size, and your hemoglobin A1C. All these things are under your control. With technology, you can get all these things in palm of your hand. You can gain access and keep yourself healthy. The healthier you are, more you got to put money aside into the health savings so you don't have to use your funds. Last but not least, number 10, don't smoke and don't do illegal drugs or abuse alcohol for your own healthcare expenditure. If you want to save money for your healthcare, you need to be healthy, folks. You need to be healthy. You need to take care. If you have mental health conditions, technology is on your side. Nowadays, easily you can be. If you are impaired, there is a health review authority that will guarantee you a certificate of guaranteed coverage. Yes. When politicians and media say there is no alternative to government control like Medicare for all and single payer, respond loudly that you know better. You think the government can do a better job than you do? You need to tell the folks, politicians or no matter who in the media, you can handle better than a government can. Yes, individually, I feel people can handle their own healthcare if you give them the choice. Consumers have a lot of power to lower the cost of the healthcare expenditure. Ultimately, all affected stakeholders need to gain from legislation. Yes. A strategy for developing a buy-in from a healthcare industry is to establish healthcare consensus. You need to develop a healthcare consensus addressing the most pressing needs of each stakeholder. Yes, I gave you the list of all the stakeholders like consumers. You're talking about uninsured, hospitals, doctors. These are all big, and insurers, insurance companies are all the stakeholders, folks. Larger employer groups, smaller employer groups, all of them are stakeholders. We need to focus on that. Legislation must, any legislation we pass through the Congress must meet the needs and allow them to function in a new, more effective, consumer-directed, patient-centric forces. It will not be easy, folks. It will not be easy to get there. Even with its flaws, some stakeholders are benefiting from Obamacare. You guys need to understand, some stakeholders are benefiting from Obamacare and the status quo. Most of the status quo. Others are fearful of political promises and change. Remember, with no consensus for a free market solution, Obamacare upended the entire insurance market, forced over 200 million Americans into government-controlled programs. with new taxes, burdensome laws, and regulations. Yes, this is what happens when the government takes over. They know better. They can't control the cost of the healthcare. Believe me, folks. Consumers are the only segment can lower the cost of the healthcare. To a large degree, politicians exploited the failures of old insurance system to pass and implement Obamacare. Opposing forces failed to offer and coalesce around a viable alternative. This consumer-driven healthcare is a viable alternative. Clearly, private market solutions exist that are better than Obamacare to reform the individual and small group market. Personalized health insurance is the solution ready to go today, so-called consumer-driven personalized healthcare. It will happen only a coalition of stakeholders, and winning the public trust will give us the solutions families need. Yes, families need. Personalized health insurance provides an option for more affordable insurance, guaranteed coverage for the pre-existing conditions, guaranteed coverage, folks, and gives choices to the remaining 27 million so-called uninsured with the new low-cost options. And the personalized health insurance is a private, free market, I would say public-private, more of a public-private partnership with a free market solution that empowering the consumer wanting both individual and smaller employer-sponsored group insurance. Smaller employer-sponsored group insurance. This is the way we need to, that's the right approach, the right solution for healthcare, folks. That will lower the cost of the healthcare. We have been spending $3.8 trillion. Still, we rank 38th in the world. No matter what, there is no simple solution, folks. We need to take control back. Your health, your health care is in your hands. Thank you for listening. Thank you for listening. Thank you for giving me the opportunity to speak directly to you. I'm asking all of you to raise the consensus of public-private partnership where everyone is insured. We'll see you in the next segment. Goodbye, God bless, and salute.